Welcome to the Thyroidless Life podcast with me, Dr. Rebecca Warren. I'm so excited for you to join me on this journey. This podcast is for you if you're wanting to know how to heal and best support your body after thyroidectomy or after being diagnosed with a thyroid dysfunction. I was diagnosed with thyroid cancer, had my thyroid removed, high-dose radiation, and my gallbladder removed, all by the time I was 20. By the time I was 21, I had health issues, struggling with depression, anxiety, brain fog, weight loss resistant, and it wasn't until I drew a line in the sand and decided to take my health back did things start to change. I spent the last decade and a half implementing protocols and healing strategies to reclaim my health and take it to the next level. On this podcast, I'll be sharing the most up-to-date studies, biohacks, and protocols, my own personal journey and recommendations on this healing path. I'll be bringing in experts in different fields of health to help you understand what you need to know to take back your health, as well as sharing my own clinical experience and coaching others that have been on this same journey. My hope is that when you listen to this podcast, you have the knowledge you need to get started and you feel empowered to take your health to the next level. Welcome back to the Thyroidless Life podcast. Today, we're talking about thyroid labs. Now, I'm really excited to talk about this. I love teaching about this, and I know this is going to be one of the most powerful episodes centered around taking control of your health when it comes to the thyroid. This is for someone, even if they've had their thyroid removed, or if they have a diagnosed thyroid issue, or if you're on thyroid medication, or you might not be diagnosed, but you think that something is wrong. I think understanding your thyroid labs can be one of the most powerful tools that you can utilize to start advocating for yourself within this medical realm of trying to get yourself well, to change how you feel and to change how you heal. Now, when it comes to thyroid labs, there's just so much that goes around it. Why there's so many people that still continue to suffer. It can be because doctors aren't ordering the right labs. It can be because they're ordering the right labs, but they're missing important stuff, or they're refusing to order some important labs, or your doctor could be ordering all the right labs and they're just not interpreting it correctly, giving you the right information when it comes to what you're getting tested, which is why I always teach, no matter what testing you get done, no matter who you're doing it with, to always have copies of what you're doing, of what you're getting tested, of your blood work. You might not fully understand what you're looking at when you get it back, but you can start to see things. You can start to see patterns. You can see things if they really are off the charts. You can see if you're trending on the low end of the range or on the high end of the range, because all of that information is helpful. But that's how you can start to learn and understand and be well informed about what's going on with your body. Now, I've been looking at the studies for over a decade and a half, right? And what I found throughout that time is I saw studies that were acknowledging the fact that individuals that were being diagnosed with thyroid issues, and these aren't studies focused on people without a thyroid because there wasn't a lot, and there still isn't a lot of long-term living without a thyroid. But what these studies found is, okay, there's patients that are on Synthroid that were doing the gold standard of testing, and they're reporting to not feeling well and still having symptoms. And what I found is that these studies would say that the reason why patients don't feel well is because they're not compliant. It has to be pretty much their fault. And I found that so disappointing because when I was trying to understand my body and myself, I'm like, wait, but I am. I'm being compliant. I'm doing what I need to do. There's something else. I mean, the good news is that I'm starting to see more studies now pointing to the fact that there's more things downstream that can be contributing to symptoms besides just getting TSH tested. Now, another thing that was a problem then, and I still see as a problem now, is medical ranges. So medical ranges are too broad. They're too wide. I mean, you know, for TSH, for example, it can go something from 0.5, like for the testing that I use for ordering blood work, it can go from 0.5 to 5.5. I mean, I came across a study that looked at, a TSH above a 2.5 can increase a woman's chances of miscarrying above a 2.5. I mean, I have individuals, they're at a 4 that are having subclinical hypothyroid symptoms, but because they're in range, they're okay. And so what I found is that not only have medical ranges been too broad, but if you go off of that while ignoring the symptoms of being hypothyroid, that is, of being hypothyroid with a thyroid or being hypothyroid, meaning not having enough thyroid hormone support after thyroidectomy, the ranges don't matter if you have those symptoms still that are pointing to this underlying issue. But then over the years, something amazing happened. But I'm going to be a little bit critical about this as well. But something amazing happened within functional medicine and the alternative health realm. And what they started figuring out is that no, we need to restrict those ranges. They need to be, more dialed in. And so that means that it needs to be like, for example, they'll say things like free T3 needs to be in the upper quadrant or like a 3.6, a 3.7 to be optimal. And the reason why this was a great thing is because now people had something to work off of. Like, no. I was at a 2.5 and the lower range is 2.3. I need to be higher. And so that helped people to understand, oh man, I can feel better and it is possible to be higher. But then something happened over time is that when you become too restrictive, then you don't account for changes within your body. I have had people that have coached that utilize fasting, intermittent fasting, they utilize ketosis, or they do fasting mimicking, or they've lost it all away because they're eating more whole foods and they're eliminating sugar, weight loss and stress levels and adrenals and the gut microbiome. All of these things affect how much T3 you need. So depending on where you're at, you might actually need less and you'll feel great. But I've had individuals that have needed less. When I first started practicing, I'm like, well, let's push it up, and they start having these hyper symptoms of feeling, like their heart. They can feel their heart, or whether that's feeling their heart beating, or having palpitations, or they're losing weight, but they're just feeling off, and then they come back down, and it's like, oh, okay, now I actually feel better. So I want to put a disclaimer here. Of course, every episode I share is for educational purposes only. Before doing any big major changes, talk to your practitioner. And I myself do not prescribe medications. I work with the whole body, natural approaches to supporting the body, but it's still the same. Whether someone's prescribing or not, what we know is to be true is that your need for thyroid hormones will change according to what's going on. So you're probably thinking, okay, well, Dr. Rebecca, like, what do I look for? Well, number one, when you're looking at your labs, you don't want to be at the bottom. I have seen over and over again, like free T3s, and I'm going to explain why I keep talking about free T3. I see free T3s in the twos, always under a 3. That right off the bat, on the low end of the range, I have not found that to be beneficial for anyone. So what you have to find is at least something above a 3, but then find a spot where you feel a change in how your body is functioning. The next thing to understand is that even if labs look normal to you, to your doctor, if you are having symptoms, pay attention to what those symptoms are telling you. Symptoms are not to be ignored, to be pushed through. It's just how you live life. Symptoms are there to communicate with you about what's going on inside of your body, right? You have to pay attention to that. And the next thing is if you are changing things up, if you're going through different seasons of life, checking your blood work, making sure you're getting tested, not pushing that off to understand what's going on with your hormones. So let's go ahead and jump right in on thyroid hormones. Let's go ahead and jump right in what should be tested and what it means. We're going to start off with TSH, thyroid stimulating hormone. Most people have heard about TSH. And guys, I'm going to give you kind of a heads up for people that still have their thyroid and a heads up for people that don't have their thyroid. Now, for individuals that don't have a thyroid, I want to give this disclaimer. Like, there isn't studies on finding out what's the most optimal range. So what I'm about to share with you is years of working with individuals that have found a good level for them, a good range for them, as well as what I have found over the past decade and a half. So when I want to give you some other options that's contrary to maybe what you hear, because a lot of what you hear and read about are levels and ranges for individuals that still have a thyroid. So let's go back to that TSH. Thyroid stimulating hormone, most people have heard about it because it's considered the gold standard, and it has been for a really long time in regards to thyroid testing. Now, TSH, one thing you have to understand is that it's a pituitary hormone. It's not a thyroid hormone. It is a hormone that's produced in order to communicate with your thyroid. It's a pituitary hormone, not a thyroid hormone. I see TSH go up and I can see downstream that everything's fine. And that'll tell me right off the bat, we've got some underlying stressors. But it is possible to have normal, quote unquote, within range looking TSH and not be optimal. And the reason why is because it's not a thyroid hormone. It's a signaling communication hormone from the pituitary to the thyroid. So TSH is released from the pituitary and it goes to the thyroid. Now, once you get to the thyroid, that's where you're going to see a majority of the thyroid makes free T4, free T3. That's where you're going to see a majority of your T4 being made. So how do you want to test to see if your thyroid is making enough thyroid hormones? You want it to be free T4, not total. Because some of you guys might be looking at your test right now and like, wait a minute, I've been getting my total T4 tested. The reason why is because you want to test free, unbound, available hormone. It's no good to you if it's bound up and it's not readily available. So looking at free T4 has been found over and over again to give a more accurate picture of that thyroid hormone production from the thyroid gland. Now, from free T4, this is really important because I am starting to see a lot of doctors talking about, getting TSH and free T4 tested. But free T4 has to be converted into its active form, which is free T3. What that means is that right now, one of the top prescribed period medication on the market, but for sure the number one prescribed medication for thyroid hormones is Synthroid or levothyroxine. And these are T4 only medication. So when you're taking a T4 only medication, you're counting on the fact that you're going to convert it efficiently by the liver. A majority of it is the liver and the gut. Majority is number one, the liver, then the next is the gut. So in order to best understand if you have enough hormones available to bind to the cell, it's not going to be free T4. Free T3 is going to let you know, are you taking enough of what you've been prescribed or are you making enough of your thyroid hormones? What's going to let you know if you have enough hormones to bind to the cell, it's going to be the type of hormone that is able to do that is able to efficiently bind to the cell, and that's going to be free T3. Free T3 is what binds to the nucleus of the cell. Free T3 is what contributes to ATP production, which is energy production for all trillion of your cells. So again, free T4 has to go to the liver and then has to be converted into free T3. Free T4 has to go to the gut and has to be converted into free T3. All right. So if you're not getting that tested, is it possible to have a TSH that looks good? Yeah. Is it possible to have a free T4 that looks good? Yeah. And then is it possible while those two look good, your free T3 is low and you still have symptoms? Yes. It is possible to still be living with suboptimal thyroid hormone symptoms because you're not converting it. You have to know if you're converting the T4 that's in your body. And if you're not, it's no good to you. That's not helpful to not know that information. Now, the next test is called reverse T3. And the interesting thing about reverse T3 is that I'm seeing a lot of resistance. I work with a lot of prescribing practitioners locally where I practice here in Chattanooga, Tennessee. And what I want to clarify about reverse T3, we know what it does. We know how it's made. But because there hasn't been a focus within studies to prove all the connection of reverse T3 contributing to all these underlying symptoms, a lot of doctors just feel like because there's a lack of interest in it, that it's not helpful. And that's completely wrong. In fact, I've come across a study looking at a link between chronic fatigue syndrome and increased reverse T3 amongst other markers in regards to thyroid hormones. There's studies being done looking at reverse T3 levels and someone's ability to recover while going to the hospital for an emergency or for an emergency procedure. Now, reverse T3 is this hormone. Let me go ahead and explain the role of reverse T3. When that T4 goes to the liver to be converted, you make some reverse T3. And what reverse T3 is this reservoir of backup of thyroid hormones. Pretty much it's an inactivated look-alike to free T3. And the reason why you create reverse T3 is because it's part of our survival mechanism. If you're chronically under stress, you'll see this free T3 grow up. If you're producing too much thyroid hormones, which can be stressful on the body, especially if it gets converted to free T3, your body's going to have this check and balance where it's going to take too much of that free T4 that you're making and put it into reverse T3. But if you're not making enough thyroid hormone, this backup reservoir will come into play because what you'll do is you'll pull from reverse T3 to make free T3. I feel like that got a little complicated there. What you do have to understand about reverse T3 is it's a wonderful marker to look at stress within the body. Because if that reverse T3 is going up and up and up, and your free T3 is lower and lower and lower, what you'll find is that reverse T3 can compete with receptors against free T3. What does that mean? Is that free T3 wants to bind to cell receptors. It wants to go to that cell and it wants to bind up on there so you can feel well, so that you can feel energized at a cellular level, so that your body can do what it needs to do on a daily basis to heal and to function optimally. But when you have reverse T3 competing with free T3, what will happen is that reverse T3 will bind to those receptors. So free T3 can't bind there. And the reason why this sucks for individuals that have this problem is because reverse T3 will bind there, but not give you all the good things that free T3 can. I like to explain it like this. You've ever had a key where it fits in the keyhole, but you can't turn it? You're like, you think it's the key to your house, but it fits, but you can't turn. That's reverse T3. It fits, but it's not going to create the cascade of events that allows you to feel well. So having high free T3 is going to point to stress, cortisol, underlying issues, and it's also going to point to possibly being hypothyroid because of that reverse T3. Now, the next two tests are going to be TPO and thyroglobulin antibodies. Now, TPO antibodies are an autoimmune marker attack against the enzyme that helps make your thyroid hormones. And then thyroglobulin antibodies is an autoimmune marker, an attack from your body on thyroglobulin, which again, you also need to make thyroid hormones. Both of these can be high in situations like Hashimoto's and Graves', and even when someone has thyroid cancer. Now, these tests are so important to get done. And this is why. Because what I have found through all these years is that number one, they either don't get tested, or number two, if they do get tested, doctors don't talk about it. And why is that? It's because there are no drugs, none, no drug on the market that can decrease these numbers. You have to get down to your autoimmune trigger as to why these numbers are high. And that matters because if you have these antibodies, it means you're having an active autoimmune reaction. We know through studies that if you have one autoimmune underlying diagnosis and issue, you are 3 times as likely to have another, which would make sense because when you have these TPO antibodies, thyroglobulin antibodies, there's an immune factor to it. And the immune system is a whole body system. So there's things in studies that connect it to having an unaddressed autoimmune issue, thyroid autoimmune issues, as increasing your risks for celiac and anemia and diabetes and skin issues and other autoimmune disorders. So if you do not get that addressed, you're increasing your chances to become sicker and sicker with more complicated issues. Now, thyroid antibodies can be high for years while your TSH looks normal, which is when you see those markers go up, you have to do something about it because you're, of course, going to feel worse over time, whether you're on medication or not. So that's the most common thing I see is that, okay, you have this autoimmune reaction, you have Hashimoto's, so you get on thyroid hormones, and what ends up happening is that you start to feel better. This idea that now you have this thyroid issue taken care of, but in actuality, you don't, because you still have an active autoimmune reaction. And so the example I like to give, it's like having a hole in your gas tank. There's a reason why you're leaking gas and you cannot hold gas in your gas tank. There's a reason why you are not able to produce thyroid hormones, and it's these antibody issues. So let's say you take your car to a mechanic, and the mechanic says, I see that you have a hole in your gas tank. And so my recommendation is, those little red and yellow tanks that you can fill with gas? I want you to fill those up, have 2 or 3 of them in your trunk, and just fill up your gas tank more often, and you're good to go. You would sit there and think, that's insane. Why don't you just correct the underlying issue so that I don't have to depend on putting more and more gas when I'm leaking it out? That's what happens. When you take in thyroid hormones, you're bypassing this natural system of creating thyroid hormones. You're bypassing getting down to the cause so that your thyroid can jump in and do what it needs to do. So you take these hormones that will make you feel better while your autoimmune reaction continues to destroy your thyroid. So underlying autoimmune issues, finding out that it's there is the first step that you need to know and you need to take so that you can actually get down to what caused that autoimmune trigger in the first place. So this is the whole explanation of what the thyroid panel should be and what it should look like. And I'm going to tell you what ranges should be or what it should look like for different people. But I do want to clarify this. Iodine. I have people that want to get iodine tested through serum. But the one thing you've got to understand is that circulating iodine versus iodine at the tissue level is going to be different. So it's not recommended to go off of serum iodine. The best way to test for iodine is an iodine loading test. And what you do is you take a high dose of iodine, and there's only a few labs that do this. If you want more information of doing an iodine loading test, check out drrebeccawarren.com and you can find more information there. But what you do is you take a higher dose of iodine and then you collect your urine. And what we're looking for is that if you're excreting a lot of iodine is because your tissue doesn't need it. But if you're holding on to a lot of iodine and you're not urinating it out, is because your tissues need it. That's going to be the best approach and not doing it through labs. So TSH, what should TSH be? Now, I already gave that disclaimer at the beginning that I am an advocate for listening to your symptoms because that's how doctors effectively helped men and women with underlying thyroid issues for decades. But you also know that I like to work within a range. So when we're looking at TSH, I'm going to give you what people with thyroid like to be at. So what I have found is that people function better. They see changes when their TSH is under between a 2 and a 2.5. So keeping under a 2, keeping it under a 2.5 is a good area to shoot for, but of course, listen to your body. But let's talk about people that don't have a thyroid. What I have found, and it's going to happen with each one of these ranges that we're going to talk about, is that someone who does not have a thyroid, I have seen through the years that they do so much better when it comes to TSH being at suppressed levels, lower than 1. Lower than 1. That's what I have found. Now, free T4 and free T3. So if you have a thyroid and you're wanting to get this test done and you're like, okay, where should I be? Overall, the best feeling, the best functioning is going to be over a 1 to a 1.2 or higher. So that's what you want to shoot for. You don't want to be under a 1, and you'll be surprised at how many people I see under a 1 with suboptimal thyroid production. Now, for those that have had their thyroid removed, I have found both free T4 and I'm going to go ahead and jump to free T3, that both of those, they do better when they're on the upper end of the range. So that is if it goes all the way up to 1.7 for free T4, I find that 1.4 to 1.7 is optimal in regards to how someone feels and how they're functioning after they've had their thyroid removed. Now let's look at free T3. Now for someone without a thyroid, I have found, like I mentioned at the beginning of the episode, that free T3 changes if you're losing weight, if you're doing a diet that changes your energy levels, like creating ketone bodies, or if you're intermittent fasting, or if you're doing fasting throughout, weeks, or you're doing a longer fast. So what I have found is you have to at least be at a 3. Now it can be from a 3 to a 3.7, I have found to be optimal. But you've got to find what's good for you. You got to play around with, where you've got to be to feel optimal. Is it possible for you to be at a 3.1 and feel optimal? Yeah, I see that all the time. I mean, both men and women that I coach lose a lot of weight. They lose a lot of inflammation. They lose a lot of toxicity. So they lose weight. They need less thyroid hormone production. But is it possible that you need to be at a 3.7? Yes. But is it possible that when you get to a 3.7, you start to feel a little anxious and you feel your heart and you feel those palpitations that are letting you feel hot, those symptoms that are letting you know that there's too much hormones? Then you listen to that and go back down. So again, a range within the 3s I have found to be very helpful for people with a thyroid. How about people without a thyroid? Upper range again. And I want to tell you why I think it's really important to talk about this, because I have had multiple times individuals that have come into my office or they've done like a virtual coaching session where they have told me that, let's say the upper range is a 4.4. They're at a 4.3, 4.4. For the first time ever, they don't need a nap. Their hair is not falling out. They feel great. But the doctor will look at those levels and say, this is too high. And then we'll cut them back and they have their symptoms again. And they're really confused. They don't know what to do because their doctor says it's dangerous. No, if you are not having signs of hyper symptoms, then guess what? That's the optimal dose for you. Always listen to what your body is telling you. You will see all the signs of whether you're hyper, you're hypo, or you are where you need to be. And you have to trust what you know to be true about living in your body. And this is why it's so important to have a practitioner on your side that's going to communicate with you, that's going to help you track yourself, your blood work, your symptoms according to the things that change that show that your body's healing and functioning better. Now, last 2 tests. Well, actually, we got to do reverse T3. But the last 2 are the thyroglobulin antibodies, the TPO antibodies. So I said the last 2 because those are 2 autoimmune tests. What you want to see is TPO antibodies should be under a 9. Thyroglobulin antibodies should be under a 1. And that's for everyone. And reverse T3, what you want to shoot for is overall as low as you can get it. 10, 11, 12. The big red flag is when you're starting to see that reverse T3 trending in the 19 and above, when it's in the 20s, 23s, 24s, and out of range, then you know there's an underlying issue that needs to be addressed. So guys, this is your thyroid labs. And I want to give you some encouragement that number one, you might not understand everything right now, but when you start understand piece by piece what's going on, what you're testing, and why you're testing, the more you'll be able to learn more and more, and the more empowered you'll feel about your health. For me, it all changed when I drew a line in the sand and I decided that no doctor was going to know more than me. I didn't do that from an ego. I didn't do it because Dr. Google told me to do it. I did it because I wasn't feeling well and nothing was working. And I was being told that it was my fault. I wasn't I was eating too many calories. I was not exercising enough. Maybe it's in my head. Am I depressed? It wasn't until I said, wait a minute, I'm not getting the right labs. And you're signing off that everything looks okay, but even the labs you were getting aren't okay. So I had to gather all of my labs and then I searched for a practitioner, a prescribing practitioner. I went in there and I talked with them and I only hired people onto my team that were going to work with me. I want their knowledge, but their knowledge has to be open to what I'm saying about my body and has to be open to what newer studies are saying about how we approach overall health and healing when it comes to the body. Thank you guys for tuning into this episode. If you have any questions, find me on Facebook at Dr. Rebecca Warren. Comment on there or go to my website at drrebeccawarren.com and submit any questions. And I'll do a follow-up episode and any and all questions that I get submitted. all around thyroid labs for someone with thyroid or someone that has had their thyroid removed. And I will see you guys next time. All right. Hey guys, Dr. Rebecca here, the Thyroidless Doc. So glad you were able to tune into today's podcast episode. If you enjoyed today's episode, I ask that you subscribe to the Thyroidless Life podcast so you can stay up to date on all my new episodes for you, and leave a review. If this was helpful for you, just let me know by leaving that review and tell me where you're from. I love to see who's tuning in and where they're from. You can also connect with me at my website at drrebeccawarren.com, as well as on Facebook and Instagram at Dr. Rebecca Warren, also the Thyroidless Doc. On Facebook, I have a free Healing After Thyroidectomy group. I created this group in hopes of having a community for people to join where they want to get better, where they want to take back their health, they want to reach the health goals that they want to reach, and they can feel encouraged by others that are on the same journey and being led by me. So I hope you find us on Facebook at Healing After Thyroidectomy group. Can't wait for you guys to hear the next episode.